Three of the top four makers of amoxicillin are reporting supply shortages across the U.S. Yahoo Finance's Anjalee Khemlani has been following this story for us. And Anj, what's the latest?
That's right, Shauna. As we know, last week we started off with just select shortages in certain pharmacies, but it's grown to a little bit of still a sporadic but nationwide shortage of amoxicillin, specifically the doses that are needed in liquid form for children. So the pediatric use of this drug, the antibacterial. There, we're looking at, antibiotic. We're looking at specifically the makers Hikma, Teva, and Sandoz, which is a Novartis company. All three of those are the ones that have reported shortages, or shortages have been reported for them, either by the FDA or other sources. And while there is efforts to sort of plug the holes, there are, like I mentioned, it's just a sporadic situation where, for example, CVS has reported shortages, but Walmart has not. So it is quite a mixed bag of a situation right now, and we know that at least the regulatory body is keeping an eye on it. And the backstory is a little bit of what you might expect with all the world situation right now, where it comes to supply chain issues, raw material shortages, and the like, and high energy costs, all really combining to create this situation. As I said, right now, still a sporadic situation, but keeping an eye on it.
All right, Anj, also the recent spike in RSV cases has been alarming, in particular with children's hospitals. I know in Hartford, Connecticut, an absolute debacle. What's the latest?
That's right. You're hearing about pediatric hospitals filling up and needing beds. This is something that is kind of like with flu in the winter. It comes through with the same level of aggression and does affect individuals. We've seen annually, on average, 58,000 hospitalization in kids, and roughly 100 to 150 deaths reported each year. And that is the concern. Health experts have been warning about what could be a tridemic this winter. And we're already starting to see it a little bit with the RSV as well as flu, as well as COVID-19 really hitting hospitals right now. The danger for kids, of course, under 5, is that this can present just like COVID as well as flu. So it is hard to figure out with an at-home test. There is no at-home test for that right now. And it's one of those things that's really pressuring the healthcare system as we speak.
Certainly an alarming surge in the number of cases. Anjalee Khemlani, thanks so much.